So thank you very much for having me here to talk today about health inequalities. In doing so, I'm obviously quite conscious that I am a white male from a high-income country, from actually quite a high-income part of the UK as well. I'm university educated and I'm middle class, so in many cases, a lot of the topics I'm talking about don't really apply to me. And I think that's really important to think about in terms of the different health inequalities that we're going to be looking at here today. So starting off, what do we mean by health inequalities? And I think in some cases we have different misconceptions or different points of view as to what we might expect that to represent. So I've got two different definitions I'm going to look at here. The first one is from the NHS in the UK. Which looks at a couple of different things. The first one is things that are unfair and unavoidable. The second one is differences in health across the population. And the third is differences between different groups within society. And we'll touch on this more as we go through. You might also have heard the term health inequity. So the World Health Organization really, their definition of health inequity is quite similar to the NHS's definition of health inequalities. And they really talk about health inequalities as measuring those differences and how that can help them to achieve health equity. The terms are used quite interchangeably. It doesn't really matter necessarily which one's the right or wrong term, but just so we know what we're talking about here today. The next thing is really inequalities between who. So we heard about it in terms of different groups and between different populations. And these inequalities can be a variety of factors. And this is from a brilliant report by the King's Fund in the UK, which is a think tank. And they've done a lot of work into health inequalities and some of the different categories they pulled out. So the first were socioeconomic factors, and particularly income, which we'll look at later. Geography, whether that's between different countries or different parts of countries as well. In the UK, we have some specific protected characteristics that are protected from a qualities perspective. So gender, ethnicity, those are really important and less relevant in terms of cancer, but it's still worth thinking about is particular groups that might be socially excluded and therefore access health services in a different way. So before we get into sort of the detail of some of the inequalities, I think it's really important to think about the importance of perspective in this context, and particularly really in that definition of different groups of people, avoiding the concept of groupthink and assuming that all patients are going to be the same. And just a bit of a sort of comic slide to explain perspective and sort of really check ourselves when we're thinking about some of this. On the left-hand side, you can see a third party's perspective. So it's what you think you see when looking at a topic. And on the right-hand side, you see it from actually the end user's perspective. This baby toy might be brilliantly designed from your perspective, but someone else who sees it from a different angle ends up just looking at the bottoms of lots of different animals. And in terms of users of healthcare systems or patients, different groups of patients might experience things from different angles or different perspectives. And it's really important to avoid assuming all perspectives are the same and really thinking about what differences might come between those different groups. In case you didn't like the baby toy, I've pulled out a song. I think that's perhaps a different way of thinking about it. And there's a lyric from what's actually one of my favorite songs, Father and Son, which I always think of when I think about health inequalities, which is, if they were right, I'd agree, but it's them, they know, not me. I'm relieved I didn't sing those lyrics instead. But really thinking just because you think something applies to you does not necessarily mean it applies to either a different individual or a different group of people.